Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. And welcome back to Magic Pill session. Today we are going to discuss very important topic, that is inborn error of metabolism. So all the question as usual, it is taken from previous year question paper, and also we are going to discuss the vital point related to that particular questions. Okay, even we are going to discuss the rationale of each and every option. So watch the video till the end. Definitely it will be so much useful for you for the upcoming examinations. And if you like the video, please like it, share it. Most of the students are watching the video without subscribing the channel. Please subscribe the channel so that whatever the video we are updating, it will reach you at the exact time. So, and also it will motivate us to post more and more videos. So please subscribe the channel. Okay. So let's begin the session with your motivational thoughts. Failure is not the opposite of success. It's a part of success. Without failure, we cannot achieve the success. Okay. So don't worry about the failure. Keep on try harder to reach your goals. Definitely on a one good day, on fine day, you will reach the goal. Okay. So with this motivational thoughts, let's begin the session. As I mentioned already, today we are going to discuss the MCQ as well as the vital golden points, which is related to that particular MCQ, and also we are going to discuss the option and rationals. Okay, so the topic what we are going to discuss today is inborn errors of metabolism. Okay, so in order to know about the inborn errors of metabolism, it is closely related to amino acid. Once again, I'm repeating, inborn errors of metabolism, it is closely related to amino acids. Okay, so you should know about the amino acids first. Okay, so as you all know, there are two types of amino acids, that is essential amino acid and non-essential amino acids. So essential amino acid, it is not produced in our body. We have to take from outside. Okay, from outside source, we have to take the essential amino acids. Okay, whereas non-essential amino acid, it is produced within our body. It is produced within our body. So that is the broad difference between the essential and non-essential amino acid. Essential amino acid, we have to take from outside. Okay, the source is from outside, and non-essential amino acid, it is produced within our body. Here are some of the examples of essential and non-essential amino acid. At present, 9 essential amino acids are there and 11 non-essential amino acids are there. You can just go through it. Okay, fine. So related to this essential and non-essential amino acids, only the inborn errors of metabolism is going to be there. So let's discuss the questions. The first question is, inborn error of metabolism or the following except. So it is a direct question and it is a except question, and this question asked in ESIC exams. So 4 options they have given here: Turner syndrome, phenylketonuria, Tay-Sachs disease, cystic fibrosis. So 4 options they have given here, and in the question they are asking inborn error of metabolism except. Okay, so as you all know, phenylketonuria, Tay-Sachs disease, cystic fibrosis, all these 3 things are coming under what? Inborn error of metabolism, except one, that is Turner syndrome. See, Turner syndrome is totally different. It is a rare genetic disorder that affects the females, and it is characterized by a missing or absent of the X chromosome. See, it is clearly mentioned here. Whatever the important point you should know, that point I have highlighted in yellow color. Please make a note of it. Okay, so here in the third point you can get the meaning of Turner syndrome. Turner syndrome, it is a rare genetic disorder that affects the females. Who is affected here? Females, and it is characterized by either missing or abnormal X chromosomes. Clear, guys? So the next, you should know, now you are clear with Turner syndrome. Now you should know what is inborn error of metabolism. Okay, without knowing that, we cannot understand the topic what we are discussing today. So what is inborn error of metabolism? It is a rare genetic, it is also called as inherited disorder resulting from the deficit of some enzymes. See, in inborn error of metabolism, there is a deficit of some enzymes. Okay, so that enzyme is very, very essential for the breakdown of protein, fat and carbohydrate, but the particular enzyme is missing. So the protein, fat and carbohydrate metabolism is going to get affected, and it is going to accumulate within the body, and it is going to create some problem within the body. So that is called as what? Inborn error of metabolism. It is a genetic disorder, and there is a lack of some enzymes, and it is causing some problems. That is called as what? Inborn error of metabolism. Hope now you all understand what is meant by inborn error of metabolism, right? Fine. Let me give some examples also so that it will be easy for you to understand. The examples are galactosemia. We will be seeing what is the meaning of each and every examples. Okay. Galactosemia, phenylketonuria, cystic fibrosis, Tay-Sachs disease, maple syrup urine disease. So these are all some of the examples. There are so many diseases which is coming under inborn error of metabolism, but these are all few examples of IEM, that is inborn error of metabolism. Okay, guys. So let's see. I have given some examples like galactosemia, phenylketonuria, cystic fibrosis. Let me give some meaning of each and everything also so that it will be easy for you to understand. Okay. Let's start from the phenylketonuria. Very important disease. So far, so many questions in the exam they have asked which is related to phenylketonuria. It is commonly called as PKU. It is an inherited disorder, guys. Okay. So phenylketonuria is a inherited, that is genetic disorder. Okay. So here, you know, increased level of amino acid, that is phenylalanine. Okay, it is an essential amino acid, that is phenylalanine. It is an essential amino acid that is increasingly built up within the body. Which amino acid? Phenylalanine. It is an essential amino acid. It is excessively built up within the body. Okay, why it is built up within the body? It is because of lack of some enzymes. Okay, so if the phenylalanine is building up within the body, the level of phenylalanine is increasing within the body, that time the patient will be getting skin rashes. It is mentioned here. You can see here skin rashes, seizures, restlessness, irritable behavior, okay, musty odor of the body or urine. Okay, so these are all the classical manifestation of what? Phenylketonuria. Okay, so this musty odor, even they can say it as what? Mossy odor of the urine. So this question also already asked in the exams. Okay, so phenylketonuria means nothing but it is a buildup of phenylalanine, that is an essential amino acid in the body. If it is accumulated within the body, the patient will be having what? Skin rashes, seizure, restlessness, and the urine smell. Even from the body, the sweat smell, it is going to be musty odor. So these are all the key points you're supposed to remember about the phenylketonuria. Okay, the next one is galactosemia. It is very simple one. It is also a metabolic disorder, that is inherited metabolic disorder. Okay, so here, you know, there is unable to process the sugar, unable to metabolize the sugar within the body. Okay, that is called as what? Galactosemia. Okay, so if this disease is there, mostly it will be there for the kids, children's, infants. Okay, so if this disease is there, means that time the kids will be having poor feeding, vomiting, jaundice, failure to thrive sometimes because it is a fatal disease, liver damage, abnormal bleeding, cataract, blood infection. So many problems will occur in case of galactosemia. Okay, guys, fine. So two examples I have covered. The third one is cystic fibrosis. Very common disorder. Many questions asked related to cystic fibrosis so far in many exams. Okay, so cystic fibrosis, it is also a inherited disorder that causes severe damage to the lungs and digestive system. This is the very important key point. Which system is affected? Lungs and the digestive system. These two systems is very commonly affected in the cystic fibrosis. Okay, apart from that, if the cystic fibrosis is there, it affects the cells that produces the mucus, sweat, and digestive juice. This cystic fibrosis is a disease. Mainly it affects the cells of the mucus, sweat glands, and digestive juice of the respiratory system and digestive system, and also some other organs. Okay, so these are all the main key points which is related to what? Cystic fibrosis. Apart from that, maple syrup urine disease, in short MSUD, short forms are very common in the exams nowadays. So maple syrup urine disease, what is this? It is also a inherited disease. Okay, here you can see prevention of breakdown of amino acids. So 3 amino acid breakdown is affected. Okay, what are all the 3 amino acid? Leucine, isoleucine, valine. These 3 amino acid breakdown is affected. Okay, so the breakdown is affected means automatically all these 3 amino acid is going to build up within the body. Okay, guys. So why this is happening? It is happening because of the deficiency of an enzyme called as, you can see here, alpha keto acid dehydrogenase. Okay, alpha keto acid dehydrogenase. The full form is branched chain alpha keto acid dehydrogenase. This enzyme is not there. That's why breakdown of leucine, isoleucine, valine is affected. So it is building up within the body, and this condition is called as what? Maple syrup urine disease. Okay, the next disease is Tay-Sachs disease. Okay, so it is a rare autosomal recessive disorder. It is caused by the absence of, I have highlighted, please make a note of it, absence of enzyme exoaminidase. This enzyme is absent in this autosomal recessive disorder. Okay, so if this enzyme is absent, means what will happen? Breakdown of fatty acid is going to get affected. Okay, if the breakdown of fatty acid especially affected, means buildup of fatty acid within the body is going to take place, especially in the brain and spinal cord. That is very, very important. In Tay-Sachs disease, buildup of fatty acid in the brain and spinal cord is going to take place. So if the brain and spinal cord is affected, means automatically the nerves are going to get affected. Okay, so on the whole, Tay-Sachs disease means there is a lack of exosaminidase enzyme. So if this enzyme is affected, means automatically the fatty substance breakdown is going to get affected. So the fatty substance is going to accumulate in the brain and spinal cord. So the neurological problem is going to happen. This is called as what? Tay-Sachs disease. Okay. The next one is G6PD deficiency is classified in the following tract. So here, this is a direct question, and here they are asking about G6PD deficiency. Okay, so this question is asked in Safdarjung Hospital. So 4 options they have given here, like autosomal dominant, dominant X-linked, autosomal recessive, and recessive sex-linked. These 4 options they have given here. So first you should know what is the meaning of G6PD deficiency. Okay, so G6PD deficiency means it is a recessive sex-linked disease. First, you should know this meaning. Okay, what is G6PD deficiency? It is a recessive sex-linked disease. I will be explaining what is the meaning of recessive sex-linked also. Don't worry. Okay, here you can see the full form of G6PD is glucose 6-phosphate dehydrogenase. As I mentioned already, it is a inherited disorder. Okay, so all the disorder, whatever we are discussing, it is a inherited disorder only. Okay, so G6PD is also an inherited disorder, and it is transmitted by X-linked recessive trait. So that point I have highlighted here. What is X-linked recessive trait? I have given the meaning for that also. X-linked recessive trait, it is a genetic condition that passes down from the or through the mutation in the gene. See, actually, through the gene, this X-linked recessive trait is transmitted from the parents to the children. Okay, here mainly this recessive trait is transmitted by through what? X chromosomes. Through which chromosome this disease is transmitted? X chromosomes. That's why it is called as what? X-linked recessive trait. Okay, what is the function of G6PD? We are discussing about G6PD, so we should know the function of G6PD, right? So G6PD, it is an enzyme that is essential to maintain the integrity of the RBC. See, RBC, you know that it is disc shape, and RBC, it is having heme plus globulin, right? 4 heme will be there and globulin will be there. Together, it is called as what? RBC. Okay, that integrity, the shape and structure of the RBC, that is maintained by the G6PD. If there is a deficiency of G6PD, what will happen? Hemolytic anemia. Okay, so on the whole, it is maintaining the integrity, shape and structure of the RBC. Okay, if it is not there, means hemolytic anemia will happen. Clear, guys? Fine. So the next one is, now you should know what is hemolytic anemia. Okay, it is like a chain. You should know one by one, right? So hemolytic anemia means yearly breakdown of the RBC, yearly death of the RBC is taking place in the hemolytic anemia because of the lack of G6PD. Okay, guys. So on the whole, G6PD deficiency is classified as what? Recessive sex-linked disease. Clear? Yes. Here RBC is affected. Okay. So the next question what we are going to discuss is an inborn error of metabolism that causes the premature destruction of the RBC is. Inborn error, that is a topic what we are discussing. Premature destruction of the RBC is caused by. So the previous question and this question is related to each other. 4 options they have given here. G6PD, homocystinuria, PKU, celiac disease. Okay. So here the right answer is option A, that is G6PD. Okay, fine. So what are all the rationals? Already I said that the second question and third question is related to each other. So here the answer is going to be G6PD. That is the one, if it is lack means RBC destruction will take place. Okay, so the answer, you got the answer. Apart from that, let me explain about the second option, homocystinuria, because that is new term, right? See, homocystinuria, it is a rare inherited metabolic disease. Here, amino acid methionine. See, you can see here methionine. I have highlighted in red color, sorry, yellow color. This methionine metabolism is affected in homocystinuria. So this methionine is going to deposit within the body, that is in the blood and the urine. That is called as what? Homocystinuria. Clear? So the next option, celiac disease. Everyone knows about celiac disease. It is an autoimmune disorder that is triggered whenever you are eating what? Gluten-rich foods. Okay, you all know that barley, wheat, and all the grain products coming under what? Gluten foods, right? So if you are sensitive to gluten foods, that is, if you are suffering from celiac disease, you should not take what? Gluten-rich foods. Okay, it is a chronic digestive and immune disorder that damages mainly the small intestine. Okay, fine. So the next question is, Guthrie test can be used for the diagnosis of. Okay, see here it is a direct question. This question is asked in DSSSB exams. 4 options they have given here: tyrosinemia, phenylketonuria, galactosemia, all of the above. 4 options are there, and here the right answer is option B, that is phenylketonuria. Okay, so Guthrie test, it is used to diagnose the phenylketonuria. Okay, fine. So what is Guthrie test? You know that it is used to diagnose the phenylketonuria. Once the baby born, that time we used to call it as what? Newborn. From the newborn, within 48 to 72 hours, we have to withdraw the sample and we have to check for what? Phenylketonuria. Okay, so this is called as what? Guthrie test. Clear? Yes. The next one is tyrosinemia. Tyrosinemia, it is a genetic disorder that prevents the body from breaking down the tyrosine. Tyrosine is also an amino acid that, if it is untreated, this tyrosine is untreated, okay, all the buildup means this tyrosine will be building up in the tissues and organs, leading to the serious health problems. Okay, this is called as what? Tyrosinemia. Clear? So 2 things I have mentioned here. Guthrie test, it is used for phenylketonuria. Okay. Next one is tyrosine. It is also amino acid. If this is not processed properly, it will accumulate within the body and it will create the problem. Okay. The last one what we are going to discuss is ferric chloride test is used to diagnose PKU, alpha tonuria, celiac disease, none of the above. 4 options they have given here. Ferric chloride test is used to diagnose option A, that is PKU, phenylketonuria. Okay, fine. So ferric chloride test, it is done in the urine. Once this ferric chloride is mixed with the urine, it gives the green color. Okay, if the green color is coming, means it shows the patient is suffering from phenylketonuria. Okay, it means there is a defect in the phenylalanine in the urine. Okay, it is also related to what? Amino acid. Okay, guys. So far we have discussed about the inborn error of metabolism. If you have any doubts anywhere, you can drop your message in the comment section. And thank you very much for watching the video. And if you like the video, please like it, share it, and please subscribe the channel so that it will motivate us to post more and more videos, guys. Thank you very much. Okay.